Hello, I'm Dr. Nadege Gunn, a hepatologist and obesity medicine specialist in Waco, Texas. And today I want to discuss a few hot topics in MASH. So number one, what's approved for the treatment of MASH? Well, foundationally, we all know exercise, healthy lifestyle, eating habits, moving, those things are foundational. But we do fortunately have two FDA-approved medications for the treatment of moderate to advanced fibrosis due to MASH. And those are Resmetirom, which was approved in 2024, and then later semaglutide in the form of Wegovy was approved in 2025. And this is great. This is revolutionary for our patients living with MASH, a disease that has not had a treatment up until recently. So we have options to offer our patients. But again, we know there are still unmet needs because these medications right now are targeting F2 and F3 fibrosis. We still need something for those with advanced disease or cirrhosis, and even those who have earlier disease, say F1 or F0 disease. Now, the question that comes up often is, when do you start one or the other? Do you start the semaglutide or the GLP-1 first, or do you start the resmetirom first? So that question, I think it depends on your patient. You definitely want to be tailoring your approach to your patient. Some of my colleagues will say, well, I like to start with the resmetirom or the Resdifra first, because we know if there are any untoward side effects such as GI issues, those will come on quickly and come off quickly. And then we can introduce the GLP-1 later, because we do know that those types of medications are in that class. Those GI side effects may be a little bit more longer lasting. Often, I would say that patients who we see in practice who have MASH already have underlying comorbid conditions to include obesity or type 2 diabetes. And we know the GLP-1s are approved in those patient populations. So I would say many of the patients that come to me are already on a GLP-1 and adequately controlled for the other metabolic conditions, yet they still have some degree of advanced MASH or fibrosis, and that makes a great opportunity there to introduce the resmetirom or Resdifra. Now, the future is bright. We do know that there are a number of therapies coming down the pipeline, and the question is often asked, well, what are we going to do in the future? What is going to be the mainstay for treatment going forward? And I believe that's going to be combination therapy. You're going to find patients on a GLP-1 with a backbone of resmetirom who may then be eligible for antifibrotic agents that are still in clinical development, but hopefully soon to be approved. And that's all I have to say. Thank you.